Hello friends. Today we're going to discuss about vagus nerve stimulation from treatment resistant depression perspective. I'm Dr. Suresh Bada, professor of psychiatry working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing with regard to vagus nerve stimulation, what is vagus nerve, what is the history behind vagus nerve stimulation, mechanism of action, what is the indication, side effects, and what are the evidence regarding vagus nerve stimulation in treatment of treatment resistant depression. Vagus nerve. It is one of the longest cranial nerve. It is the 10th cranial nerve. It runs from brain to the various parts of the intestine. It is also called as wandering nerve, the Latin word for vagus. It plays a crucial role in parasympathetic nervous system. That means it plays a role of rest and digest. On the other hand, sympathetic nervous system discusses and play a major role with regard to fight or flight response. Vagus nerve comprises of left and right vagus nerve. It has approximately 1 lakh fibers in each of this vagus nerve. And it is the longest cranial nerve, and it plays a crucial role with regard to autonomic nervous system, specifically parasympathetic. It contains both sensory and motor fibers. It has a long, winding course which starts from the brain, specifically from medulla oblongata, moves towards the neck, thorax, abdomen, and various part of the intestine. With regard to neck, it comes out of the skull through jugular foramen, where it is within the jugular sheath between carotid artery and jugular vein. And in the chest, it forms plexus called as carotid plexus, and also it forms cardiac, abdominal, and digestive plexus. So these are the important plexus which are formed by the vagus to provide various function. This is the vagus nerve where you can see the parasympathetic coming out of the medulla oblongata and providing the connections towards the heart, lungs, intestine, liver, gallbladder, kidney, and also to the various sexual organs. If you look at the main function, as I said, vagus nerve is both a sensory and motor fibers. 80% is a sensory, that is afferent nerve. That means the information comes to the central nervous system. On the other hand, 20% is only the motor function. The sensory fibers nuclei, either they are in the jugular or in the nodus of ganglion. The motor fibers, which is hardly 20%, form the neurons of the dorsal motor nucleus of the vagus and nucleus ambiguous. If you look at here, it clearly talks about the vagus nerve supplying to the various part of the body through the motor system, that is motor fibers. At the same time, there is 80% of the sensory fibers receiving information from various parts of the body, specifically intestine, heart, lungs, and also the pharynx, larynx. Here, the vagus nerve brings in the important information through the vagus nerve and enters to the medulla oblongata. From there, it enters to the nucleus of solitary tract, from there to locus of Ceruleus. From here, it supplies to cerebellum, hippocampus, amygdala, various limbic system, thalamus, prefrontal cortex, and also the anterior cingulate gyrus and various parts of the cortex it supplies. That means it has a projection across the brain. Here, the vagus nerve has been considered as an important superhighway for the brain, delivering information with regard to digestion, heart rate, mood, and also the immune system, especially immune response. Vagus nerve is a critical component of parasympathetic system and which regulates heart, that is blood pressure, heart rate, and respiration also. With regard to digestive system, it plays a crucial role with regard to secretion of various enzymes, gastric acid, bile, at the same time movement of the small intestine, large intestine, and plays a crucial role with regard to digestion. At the same time, it also has been known to play an important role with regard to immune, especially inflammatory system of the gut. If you look at the type of nerves with regard to vagus nerve, as I mentioned, 80% is sensory, 20% is motor. Being a sensory afferent, that means the information comes in. 20% being a motor, it provides information that is goes out of the brain, that is efferent. So E means exit. That is the way to be remembered. If you look at the fibers, A alpha and A beta fibers forms the majority of them, and then A alpha, it forms the efferent. And if you look at the A delta, B and C fibers forms the sensory and autonomic. Here we need to focus on A beta. A beta is both a sensory and motor, but that is the nerve we need to stimulate with regard to important nuclei which need to be stimulated for the having a maximal effect. So we have to be very specific. It is to have an antidepressant effect. A beta fibers have been found to be playing a crucial role. Invariably, the maximum amount of A beta fibers is seen in the cervical part of the vagus nerve, and especially less in auricular branch of vagus nerve, because there are studies with regard to transcutaneous auricular stimulation of vagus nerve also been there. I'll be discussing shortly. Now let's look into the history of vagus nerve stimulation. In the early part of the 19th century, the American neurologist James Corning initially used electrical stimulation to treat epilepsy. He believed the blood supply to the brain plays a crucial role with regard to epilepsy. That was his belief. So he tried to stimulate vagus nerve so that he can control the blood supply to the brain. But he did not yield much. But however, that was the opening gate for vagus nerve stimulation and also research in epilepsy. And later, over a period of 50 years down the line, there were some incremental researches. But however, the major breakthrough came when Zancati and his colleagues found that vagus nerve stimulation in cat caused cortical desynchronization and epilepsy was inhibited. And exactly after 100 years, VNS research played a major breakthrough by Professor Jacob Zabra, who played a crucial role with regard to vagus nerve stimulation. In his seminal work, Professor Jacob was able to induce seizures chemically in canines, especially dogs, and he was therapeutically able to stop the seizure by stimulating vagus nerve. This was a landmark study and was published, and there onwards, there was no stoppage of with regard to vagus nerve stimulation. Shortly after that, clinical human studies of vagus nerve stimulation started, and especially with regard to treatment of epilepsy. In 1997, there were many studies. This led to United States Food and Drug Administration, that is FDA, approved vagus nerve stimulation in treatment of treatment resistant epilepsy, that is refractory epilepsy you can call. And this played a crucial role. When they were studying the follow up of epilepsy patients, they found that their mood improved remarkably, quality of life improved, many of them came out of depression. This indicated that patient who had depression and also epilepsy, the depression was cured or remitted. And later, slowly, there were various studies done on depressive patients. This led to enhancement of mood, and also they found that vagus nerve stimulation also enhanced certain cognition. Hence, there were many studies which related to cortical excitability, which has been modulated by vagus nerve, effect of mood, and hence in 2005, FDA gave approval for treatment of TRD, that is treatment resistant depression. So VNS was approved. Later, it has been approved for various disorders. I'll be discussing that. Here, by looking at this history, research clearly indicates VNS plays a major role in inhibiting the various parts of the brain, stopping seizure, cognitive enhancing, at the same time, antidepressant, anti-epileptic, neuromodulator, and also cognitive enhancing. It also played a crucial role in arousal and attention, short term memory, verbal memory recognition, working memory and memory consolidation, and finally, memory and decision making. However, with regard to VNS, there has been certain discrepancies with regard to cognitive improvement versus disturbance. But the studies slowly are mounting towards cognitive enhancing capability of VNS. If you look at the history here, again clearly, it started in 1880 by Cornings, and then the landmark study by Zabra came into picture. After that, FDA in 1997 approved for refractory epilepsy, and then in 2005 for treatment resistant depression, and in 2015 FDA approved for obesity, and later for cluster headache in 2017, and in 2021 it has been approved for post stroke motor rehabilitation. That means it has been approved for 5 various disorder. So my dear friends, vagal nerve stimulation plays a crucial role in various treatment resistant treatment aspects. Let's look into the classification of vagus nerve stimulation. There are two important classifications. One is non-invasive and invasive. Let's understand what is this non-invasive and invasive. Non-invasive means there is no incision is made, no surgical procedure is done. The stimulation of vagal nerve is done by electrical stimulus through cutaneous. Hence, it is called as transcutaneous vagus nerve stimulation. There are two types: transcervical vagus nerve stimulation, another one is transauricular vagal nerve stimulation, and finally, invasive, that is direct vagal nerve stimulation. Here, there is a procedure is done where surgical procedure and a pulse generator is kept in the body and leads are connected to the left vagus nerve. Let's discuss all the three. If you look at the vagal nerve stimulation, electrical impulse either directly given through cutaneous or by making a surgical incision and placing the electrodes directly on the vagal nerve. From there, small painless electrical stimulus is given to vagus nerve, which indirectly sends these electrical impulses to the brain and brings about a lot of changes with regard to neuromodulation and improvement in epilepsy. Basically, the epilepsy gets controlled, depression is improved, of course, headache, especially vascular attacks, and invariably obesity, and the post stroke motor rehabilitation. Now, let's understand the non invasive auricular vagal nerve stimulation. If you look at the vagus nerve, which comes out of the jugular foramen, it has various branch. Invariably, the first branch move towards the it's called as auditory branch, which after coming from the jugular foramen, it enters again into the temporal mandibular fissure. From there, supplies to the various parts of the ear. We will discuss about that. From there, it goes down through the neck to the thorax, abdomen, and to the intestine. Here, we are interested with regard to auricular branch, that is towards the ear. If you look at the auricular branch, here is the auricular branch, and this auricular branch which supplies the specifically that auricular branch of vagus nerve, that is the concha, that's where we are supposed to get the stimulation. If you are able to stimulate this, they have found there is some improvement with regard to depression. These are early exploratory studies. If you look at the ATN, that is auriculotemporal nerve, and then the auricular branch of vagus nerve and greater auricular nerve. Here we are interested only in the auricular branch of vagus nerve. Now, this is the way the electrodes are placed for stimulation of auricular branch of vagus nerve. And if you look at this, the stimulation of auricular branch of vagus nerve directly goes to the locus of Cyrillus and also the nucleus of solitary tractus, from there to various part of the limbic system, hippocampus, medulla, insula, prefrontal cortex, motor cortex, and anterior cingulate cortex. So from this excitation, it leads to the inhibition of various neurons through GABA, and that has some improvement has been noted. So this is how the ABVN stimulation, this is one of the pathway how it regulates mood. From there it goes to the various part of the medulla oblongata, that is nucleus of solitary tractus and dorsal vagal nucleus. From there vagal afferent, and also it the sympathetic nerves are also inhibited here. So this is the one of the mechanism it has been found to be useful in understanding transauricular stimulation of vagal nerve. So there have been studies which was published in Nature. Kim and his colleagues looked into the safety of the transcutaneous auricular vagus nerve stimulation, a systematic and a meta-analysis. This specifically looked into whether transauricular vagus nerve stimulation causes improvement or any side effects. The results were very clear. Overall, transauricular vagus nerve stimulation is safe, feasible option for clinical intervention in treatment resistant depression because since it is non-invasive, it is very economical and can be done on OPD procedure. Once the patient learns, he can do it at home. So these are the advantages of vagal nerve stimulation through transauricle. But however, we need to do further research, RCTs, looking into how much stimulation has to be given. In a day, it has to be given maybe 3 times, 5 times. What is the dosage? Should it be done on right side, left side, both? Are there any other branches to be stimulated? Those are the important research need to be carried out. Now let's move into non-invasive cervical vagal nerve stimulation. Here, the cervical part of the vagus nerve, which moves through the neck, that is specifically on the sternocleidomastoid and especially between the carotid and the jugular vein, where the jugular sheath is there, where it passes through. From there, we need to stimulate. This is how it can be seen in the diagram. Here, the target of VNS is done. This vagus nerve has to be stimulated. That causes again the similar to as I mentioned in the previous to the transauricular, same mechanism applies here also. This is how the stimulation is done in the neck. That is specifically keeping on the sternocleidomastoid. The mechanism of action of both are same because if you stimulate either the vagus nerve with regard to in the neck or the transauricular, both will be playing a role through the vagus nerve. Now coming to the traditional invasive vagal nerve stimulation, or we can call it as direct vagal nerve stimulation. Here the electrical impulse is stimulated to the left vagus nerve, not to the right. Why? The simple reason is the left vagal nerve stimulation also supplies to the heart, especially SAN, whereas the right supplies to the atrioventricular. If you stimulate the right, there is high possibility we are going to cause heart block. Hence, the left vagal nerve stimulation is chosen. Here, the healthcare provider, the doctor will place the implant, the small device in the chest, especially in the subclavian fossa. From there, wire passes through the skin and through the sheath of the jugular foramen. From there, it will be placed on the left vagus nerve. After that, the mild, painless electrical current signals are passed through the left vagus nerve to stimulate the brain. Here you can see here the VNS, that is vagal nerve stimulation directly. You can see clearly the pulse generator is kept in the subclavian fossa, and then it is done only for the left side. Simple reason is sinoatrial node is the one which will be supplied by the left. If you stimulate the right vagal nerve, it will inhibit atrioventricular node that can cause heart block. Hence, the left one is chosen. Here, when the mild electrical current signals are passed to the left, it will causes the projection in the brain to improve mood regulation. I'll be discussing shortly. Here, this is how the vagal nerve stimulator is seen. There is a pulse generator, and then you can see the lead wire. From there, the electrode, which will be placed on the left vagus nerve. And it has been found to be very useful in treatment resistant depression. Here, the low current, the dosage between 0.25 to 2.5 milliampere is delivered. I'll be talking about how the dosage will be delivered. Here, there are studies have been done, looked into what is the dosage of the electrical current. There was a study done where the low, medium, and high uh, electrical current were given, divided based upon the low current is 0.25 milliampere, and if in the medium means zero point 0.5 to 1 milliampere, and the high means 1.25 to 1 milliampere. Here, the patient chosen were 331 patient who did not respond to approximately 6 antidepressants. That means they were severely resistant to antidepressant. Again, if you look at the low electrical current, 130 micro S will be chosen. And when the study was done, the stimulation was given in the cycle of 30 seconds on and 5 minutes off. That means every 5 minutes there will be 30 seconds of stimulation will be done. And the pulse frequency was 20 hertz. When they did the study and looked at the end of the 5 months and then later into the long term, they found that at the acute phase, that means within 5 months, 4 to 5 months, the all the patient improved. But in the medium and long term, that is between the 12 months to 24 months, invariably the medium and the high dosage, that is between the zero point 0.5 to 1.5 milliampere patient showed a significant improvement when compared to the others. So, my dear friends, the vagus nerve stimulation, here we are given zero point 0.5 milliampere to 1.5 milliampere. But however, this traditional vagus nerve stimulation, the surgery cost is somewhere around $2,000 to $3,000, and the cost is the instrument. The instrument, that vagus nerve stimulator, costs somewhere around $18,000 to $20,000. Total cost will be somewhere around $20,000 to $25,000 with follow-up charges and everything. And invariably in India, it will come around 20 to 25 lakh rupees. Here afterwards, maybe after some time, once this pulse generator is being manufactured in other parts of the country, and once the patent is off, the cost of this VNS may come down drastically. But at this point of time, the cost is very high. The procedure of vagal nerve stimulation is uh, the first and the foremost, you need to know what is the diagnosis of the patient, whether the patient has psychosis or not, whether the patient is clearly a treatment resistant depression. We need to look into the treatment history, diagnosis, comorbidity, and once you are clear we are dealing with the treatment resistant depression, then you have to take informed consent, discuss about the cost, and then the surgery to be planned. Once the surgery is planned, on the day of surgery, a small incision is made on the subclavian fossa where the pulse generator is kept. From there, under the skin, the electrodes are passed, and then from there, it will be placed on the left vagal nerve. From there, the leads are placed on the left vagal nerve, and then the patient, the sutures are closed. And then the device is activated in the follow up. And slowly over a period of time, by trial and error method, the dosage, either the zero point 0.5 milliampere or 1 milliampere or 1.5, to the extent some of the studies have said the maximum dosage the patient is able to tolerate, that has to be given. And this is based upon that the IP care will be 2 to 3 days, but in the follow up, you need to monitor the side effects and then look into how much is the dosage of the electrical current to be given. By dose adjusting is through trial and error basis. What are the side effects? The side effects of vagus nerve stimulation is invariably the risk of infection at the site of the implant. Invariably, some of them may have voice changes, hoarseness of voice. Some patients, whenever the stimulation occurs, breathing difficulty can occur, and rarely that has been seen. The patients, when the stimulation occurs and when they do exercise, they may feel certain discomfort, but over a period of time, that also improves. But however, temporary side effects like headache, neck ache, coughing, or tingling sensation has been noted. If you look at the indication for vagus nerve stimulation, the Food and Drug Administration of US has approved for five important indications. First and the foremost, refractory epilepsy, treatment resistant depression, both for unipolar and bipolar depression, obesity, cluster headaches, and post stroke motor rehabilitation. What is the mechanism of action? Here, the important thing is we are stimulating the vagus nerve. The vagal nerve directly enter into the locus of cerulli, that is the main important area where norepinephrine is released in the forebrain. Most of the VNS effect is seen by animal studies, and the important is locus of cerulus and also the solitary tract of nuclei, where the aggregation of the norepinephrine uh, is more commonly seen. However, the animal studies also discusses about synaptic plasticity with regard to hippocampus and also other part of the brain projection. There was a study which has been done, especially in rats, and they found that the innervation, especially the locus coeruleus and the dentate gyra CA1, CA3 areas, there is the neuronal plasticity occurs. Here, on application of VNS in rat showed increase of norepinephrine levels, dopamine level, long-term potentiation, synaptic spine density increased in hippocampus, brain-derived neurofactors expression increased, and immediate early gene expression. That means it's not only at the neurohormonal level, but also at the gene expression and neuronal plasticity. Here again, we can see the projection of vagal nerves. The vagal nerve from the nucleus of solitary tractus, which is from the medulla oblongata, it goes to the locus of cerulus. From there to the hippocampus, limbic system, hypothalamus, thalamus, prefrontal cortex, motor cortex, and various parts of the cerebrum. So, my dear friends, here the projection from the locus of cerulus to the entire brain plays a crucial role with regard to the improvement. Especially the various imaging studies have implicated the increased blood flow, especially the functional neuroimaging, insula, prefrontal cortex, anterior cingulate cortex, thalamus, amygdala, hypothalamus, dorsal raphe nucleus, parabrachial nucleus, locus of cerulus, and nucleus of tractus solitarius have been implicated in the improvement or the mechanism of action. So, to summarize the mechanism of action, we do not know exactly, but however, by looking at the projection, the afferent neuroanatomical pathways of the vagus neurons to the brainstem, subcortical and cortical region plays a critical in the mood improvement. Brain imaging studies have shown improvement in the mood by the way of improving the blood supply to the various parts of the brain, especially anterior insular cortex, prefrontal cortex, limbic system, amygdala, hypothalamus. So these are the important changes has been seen, and it has been seen not only in the acute phase but also in the sustained vagus nerve stimulation. Vagus nerve directly increases the activation of the serotonergic, noradrenergic neuronal firing, and indirect evidences indicates dopaminergic system also gets activated. Further, animal studies also demonstrates the neuronal plasticity. Now let's understand How vagal nerve stimulation studies occurred in the treatment resistant depression. Invariably, the treatment resistant depression is very difficult to treat. In spite of available more than 50 antidepressants at this point of time, various augmenting agents, mood stabilizers, and various neuronal modulation studies, and also the instruments, only the 60% of the patient improve by the first line of treatment, and further another 10 to 15%. That means only one third remit, one third will have treatment resistance, remaining one third will have partial improvement. That means by giving medication, the complete remission occurs in one third, two third either will have partial remission or else treatment resistance. That means we are going to see the treatment resistance in a high number of patients. And this high number of patients invariably have increased morbidity, mortality, occupational dysfunction. If you look at the various studies, it said that the first SSRI improvement causes only 36%, second will further push to 30%, and finally third and fourth will improve further. So 30% of them do not improve in spite of sequential trial of antidepressants. The study done by Kemal and his colleagues in 2002 published in Journal of Neurological Science. The title of the study was Vagus nerve stimulation, an update on the novel treatment for treatment resistant depression. They did the review of the various vagal nerve stimulation studies with regard to treatment resistant depression. Although this is not a systematic review, it's basically looked into the academic review, and they looked into how these studies have been conducted. They also mentioned there is a heterogeneous studies, various comparison with regard to treatment resistant depression. Definition was not adequate. The comparison, open label versus RCT versus comparing arm, various methodology was there, hence they were not able to do that. The results of this study clearly indicated the vagal nerve stimulation found to be helpful in treatment resistant depression. Although mechanism of action of VNS and TRD is not fully understood, the brain imaging studies had shown that there is increased blood flow, neurohormonal change, and neuroplasticity. Another important meta-analysis was done. That is study done by Berry and his colleagues in 2013. This is one of the earlier meta-analysis which looked into the patient level meta-analysis of studies evaluating vagus nerve stimulation therapy for treatment resistant depression. They included 12 different studies which were heterogeneous. Some of them were RCT, some of them were open label, some were comparing VNS with the treatment as usual or treatment as usual plus VNS. That means just not vagus nerve stimulation alone. So they assessed at the 24 weeks, and they found that treatment as usual plus VNS showed improvement at 24 weeks, retained at 48 weeks, and 96 weeks also. For the patient with chronic treatment of VNS plus treatment as usual, that is more than 24 weeks, the patient continued to show improvement at 48 weeks and 96 weeks. That means the sustained improvement occurred for more than 1 year. Another recent meta analysis by Bottomley and his colleagues in 2020, published in Comprehensive Psychiatry. The title of the study is Vagus nerve stimulation therapy in patient with treatment resistant depression, a systematic review and meta analysis. This meta analysis looked into the long term follow up. They used Madras score in the follow up at 6 months, 12 months, and 24 months. The comparison between VNS plus treatment as usual versus treatment as usual alone. If you look at the response rate and remission rate at 6 months, 12 months, and 24 months, VNS plus treatment as usual showed a significant improvement when compared to treatment as usual. Even with various other scales, it has been found to be the quality of life also improved. VNS was very effective in treatment resistant depression, both in acute and also in the long term. VNS was well tolerated. This meta analysis reported 5.5%, that is 5% of the patient had some significant adverse event at 12 months. That means per year, you are going to see around 5 to maximum around 6 to 7% of them may have some significant adverse effect, mortality was not noted. To conclude, my dear friends, treatment resistant depression occurs very commonly. One third of the patient do not respond to any medication. One third will respond only to the partial. Hence, we need to look into various other treatment aspects. Although we have 25 plus antidepressants, neuromodulation, ECT, and various other treatment available, but still the treatment resistance depression continues to throw challenge because of mortality, morbidity, occupational dysfunction, poor quality of life. Neuromodulation, especially the direct vagus nerve stimulation, has found to be very effective, especially in treatment resistant depression, especially the direct stimulation. However, non invasive is slowly unraveling the easiest method of stimulating, which can be done on OPD basis. However, the vagus nerve stimulation, especially the direct one, is an invasive procedure. The cost of this stimulator, or what we call it as VNS pulse generator, the cost is very heavy. That means around $15,000 to $20,000, and the total cost may go up to $25,000. In Indian rupees, it is around 20 lakh rupees. However, the non-invasive transcutaneous vagal nerve stimulation, either transaurical or transcervical, has found to be effective, not as effective as direct stimulation, but it is cost effective and can be easily done in the OPD basis. The mechanism of action of VNS has found to be upregulation of neurotransmitters, norepinephrine, serotonin, dopamine, and GABA has been found to be there in various studies, especially in the animal studies. Increased gene expression, especially neurotropic factors, brain derived neurotropic factor, and fibroblast growth factor. Non invasive VNS needs to be further explored, and various research has to be done, especially transaurical and transcervical, because the cost is one of the biggest. But however, over a period of time, this cost may come down and it can become a boon for a treatment resistant depression. Thank you very much for giving your valuable time. Stay safe.